In this final segment, we'll look at what published studies have had to say about treatment efficacy with children with speech-sound disorders, and see if the current literature can serve as a reasonable guide in choosing treatment approaches. As we noted in prior segments, work over the past decade has been fairly consistent in calling into question the underlying rationales for using non-speech oral motor treatments with the intent of improving speech. However, we should also look closely at the treatment efficacy literature to see if non-speech oral motor treatments might actually work to improve speech for some other reason. In other words, maybe the rationales were wrong, but the treatment still works for some other reason. To date, the reports that indicate efficacy of non-speech oral motor treatment programs resides almost entirely outside of the peer review system. This does not make the evidence worthless, but it does raise questions about the rigor of that information and the scrutiny that it's received. This situation often exists for one of two reasons. Either the studies themselves were conducted with less than acceptable rigor, such that it didn't meet adequate standards for publishing, or the editorial process contains a systematic bias against certain ideas, such that papers that challenge the conventional wisdom are rejected out of hand. However, there have been peer-reviewed studies documenting treatments involving non-speech oral motor treatments that have showed one of two results: either no improvement in speech at all, or no difference in outcomes between treatment focused only on speech movements and treatment that incorporates work on non-speech movement tasks. The implication is that non-speech oral motor treatment activities do not provide a unique benefit to a treatment plan that's focused on speech. On the other side of the coin, there are studies that have shown improvements in speech skills when treatment is focused on speech. In fact, multiple treatment approaches have been shown to be efficacious in studies across many years, leading to Judy Garrett's statement from nearly 20 years ago that treatment of functional phonological disorders in children is an established, well-documented form of clinical intervention. The implication of the collected literature on the topic of non-speech oral motor treatments can be summed up in the sentence, "If you want them to learn speech, then get them to practice speech." Note that this statement is only about treatment that's focused on treatment of children with speech-sound disorders. If a child also happens to have a clear non-speech oral motor disorder, then it's quite possible that non-speech oral motor treatment activities will have an important role to play. It's just that we should not expect gains from non-speech treatments to have automatic benefits for speech-sound production skills. So, to quickly summarize the state of the literature regarding non-speech oral motor treatment. There is no transfer that should be expected from simple non-speech behaviors to the more complex task of speech production. Children with speech-sound disorders do not seem to have deficits in oral articulator strength compared with children who do not have speech-sound disorders. Therefore, it's unlikely that strength is a causal factor in speech-sound disorders. The actual implementation of non-speech oral motor exercises is done in a way that would be unlikely to produce gains in strength in the targeted muscle groups. Evidence on developmental trajectories indicates that non-speech oral motor behaviors are not precursors to speech. Evidence shows that non-speech oral motor treatments do not result in distinct gains in speech-sound production skills, while evidence shows that speech-focused treatments do have an effect on speech-sound production skills. And again, most of this can be summed up in the mantra-like statement, "If you want them to learn speech, then have them practice speech." Thanks for watching this brief review of the literature on non-speech oral motor treatments for speech production.